Good afternoon, friends. Welcome back to yet another episode of Diabetes Patient Education video series. Friends, as we all know, diabetes is a chronic disorder, and there are so many complications, including the microvascular and macrovascular complications of diabetes. But are you aware of one very important complication that we call as the sixth complication of diabetes, that is periodontitis? What do we mean by that? It includes all the infections or inflammations of the oral cavity, the gums, the teeth, the tongue, and other things, palate, cheek, inside of the cheek. So it is very important. Why? Do you know? Because increased blood sugar leads to infection of the oral cavity, and the vice versa is also true. That is, if you have infections in your oral cavity, then there will be too much difficulties in managing your diabetes, or optimal control of diabetes will be very difficult. So why is it so? And what we can do to maintain our oral hygiene and to prevent the complication of periodontitis. Friends, this is Dr. Jagadish, your diabetes well-being coach, director, Masterdoctor Group Clinics. Today, in this video, we are going to talk regarding the sixth complication of diabetes, that is periodontitis. People with diabetes are at higher risk of developing oral health problems such as the gum disease, dry mouth, fungal infections, and it is important for the people with diabetes to take good care of the teeth, gums, and the oral cavity as a whole to prevent these problems. So let's now discuss about what we can do to prevent. So first and the foremost thing that we need to brush, that's the very primary oral care thing. We need to brush twice daily, and it is preferable to use soft bristle toothbrushes. And those patients who do have the gum disease, or they have worsening of the gum disease, they can even brush in the morning with the brush, and after taking dinner you can brush with your fingers. Okay, so that's very important, and the primary function is to clean the teeth and in between the teeth and the oral cavity as a whole. Okay, so moving back to the second point that is associated with, flossing. So you should floss at least daily, or at least on alternate days, to remove the plaques, or to remove any food particles, or any particles that is stuck in between your teeth. So that will again, because if you do not remove, so it is going to harm the teeth structure, or it may cause tooth decay and all that. So that is very important. Okay, and used only certified floss material. Do not use threads, or any sharp objects. Like usually people, they use toothpicks, that can harm your gums and teeth a lot. Please avoid doing such things. I hope you understand the importance. Then coming back to improve your oral hygiene, we many a times ask you people to rinse with some antiseptic or antimicrobial mouthwash. So these are all important things to maintain your oral hygiene. So you can either use antimicrobial mouthwash, or else you can simply use salted lukewarm salted water. So that also is a very good home remedy. You can use that instead of using antimicrobial wash. Whatever it is, our aim is to keep our oral cavity infection proof and prevent the other spreading of the infections. As we all know, our oral cavity is the pathway for the entry of all the pathogens into our body. Moving ahead, you should visit your dentist. At least it is recommended once in a year. If you have any sort of gum problems, you can visit more frequently, but at least once in a year you should go to your dentist for a complete dental checkup if there are any problems, because as I already we have discussed that with having ongoing dental infections or oral cavity infections, periodontitis, it is very hard to control your blood sugar. So we need to take a look at that. And finally, drinking plenty of water daily, and during drinking it will flush your mouth and will keep it clean. And as a point of hygiene, you should always wash your mouth after taking any sort of food, any small snacks or anything. It's always better to wash your mouth, to rinse your mouth. So these are the 5 things, starting from brushing, flushing, mouth washing, visiting your dentist, drinking plenty of water, flushing your mouth with normal water. These are few important things you can do on a daily basis to keep your gum, your mouth, your teeth, your oral cavity safe from pathogens and prevent the onset of periodontitis, and thereby getting a good control. And hope you are going to follow these tips and maintaining a good oral hygiene. Hope you liked the video. If you liked it, just like this, hit the like button and share also with your friends, your family, with your all acquaintances, and share the knowledge and help. Our aim is to educate you people, to help prevent the onset of the complications, thereby helping you to live a life healthy, happy, and life of well-being, even if you are with diabetes. For any suggestions or any experiences you want to share, any questions, any comments, you can always type those in the comments box. I would love to answer those. Maybe I can include few of those in my coming videos. I can make new videos. Friends, it was nice talking to you really, and we will come back to you again with another new video. We will keep working and keep fighting. Remember friends, together we can fight diabetes. We are there with you in your fight against diabetes. Thank you and have a good day.